Tim. I'm really excited about the new interest group. I'm going to very quickly introduce Alex because I know his talk is timing 8 minutes, and I don't want to take one of his precious minutes away, but it is such a pleasure to introduce him. Alex has been working on a project through his own initiative for the past several months, and he comes to us with a fair amount of experience. He's worked on 2 other research projects, which were more biomedical in nature. And this project, as you'll see, is more of a clinical health services project. He's independently sought out a lot of experience to prepare him for his career, one of which has been that he's recently become a volunteer for Big Bend 2-in-1 doing crisis outreach counseling, which is a really rigorous training and really excellent experience. And I think I just want to mention that I've been immensely impressed with Alex's leadership, his competence, his autonomy. So he's really gone after every part of this research project and made it his own. And so everything that you'll hear about were things that Alex independently worked on. So he's going to be a great person to have as a doctor because he's very calm, he's very competent. And so I really want to thank you for all your work on your project, Alex. Please welcome him.
Good evening, everyone. I'm going to be talking about e-health interventions to improve detection and treatment of perinatal depression. This was my project that I worked on over the summer. Perinatal depression is defined as clinical depression around the time of pregnancy. It's one of the most common complications of pregnancy. Depression and anxiety during the perinatal period are a significant health disparity that still need to be addressed. E-health is a promising new field that potentially offers a new model for efficient and effective detection and treatment of perinatal depression. It's critical that we develop approaches that can be implemented in places that women seek prenatal care. As many as 1 in 5 women experience depression around the time of their pregnancy. More than 1 in 5 of these women go untreated. Some of the reasons that the treatment rates are so low are because of lack of screening, the low availability of mental health care services in our community, inadequate health insurance coverage, lack of knowledge about mental health care in primary care settings, and there's still also a major social stigma to having mental health care issues, especially around the time of pregnancy. Depression during the perinatal period can have devastating consequences, not only for the woman, but also for her children and for her family. As you can see here, babies that are born from depressed mothers are more likely to have impaired bonding, as well as many other consequences that carry through to the rest of their lives. There's a need for research on screening and treatment strategies in prenatal care settings. The Agency for Healthcare Research and Quality concluded that there's a lack of quality evidence to guide perinatal depression screening practice with a goal of improving outcomes. In order to increase detection and treatment of depression, we need to find a practical solution to integrate a system for mental health care screenings and referrals into a primary care setting where most women around pregnancy already go for the health care. The ACNAW study is meant to be an exploratory research project. It's meant to test an electronic depression screening tool and anxiety screening tool for effectiveness and feasibility. This pilot project will lay the foundation for a larger project that aims to compare the effectiveness of emerging models for screening and intervention of mental health care and prenatal care settings. The purpose of our study is to test the feasibility and usability of the e-health intervention screening tool, to collect data on rates of depression and anxiety and prevalence of treatment, and to explore patient perceptions about mood influences using motivational interviewing-based questions. Our study design was cross-sectional mixed methods. The first part was collecting data from the patients at North Florida Women's Center using the iPad screening tool. And the second part of our study was collecting qualitative data from interviews that I conducted with 2 OBGYNs at North Florida Women's Center. The data collected from the patients included demographic data, results from the depression screening tool, results from the anxiety screening, patient perceptions on influences, and usability of the iPad screening tool itself. On the left here, you can see this is an example of what our patients fill out. I take this iPad into the waiting room and I hand it to a patient, and they have the privacy to fill out this screening tool. This is a portion of the screening tool that they fill out there, which consists of the demographic data, the depression and anxiety screening tool, and the usability of the screening tool itself. Once they filled it out, you can see on the right is an example of the summary that the clinician sees. They take the iPad back to the exam room with them, and they hand it to the clinician, and all the clinically relevant information is summarized in one screen so that the clinician can quickly review it and start a discussion about mental health care with the patients. Our patients our data was collected from 125 patients seen at obstetrician and gynecology patients from North Florida Women's Center. The average age of our patients was 42 years. As you can see from our sample, it's important to note that we have a higher household income and proportionally more Caucasians in the whole of Tallahassee in our patient sample. If we were to apply this screening tool in a more underserved demographic population, the results could be deviated. Our findings from the depression questionnaire showed that 47% of the women had experienced depression symptoms in their lifetime, and 21% had been diagnosed with depression. Of those women, over 80% of them have never received counseling or medication. Our anxiety questionnaire showed that 17% of the women had been diagnosed with anxiety, and only a quarter of them had ever received medication or counseling treatment. Our own anxiety and depression screening tools showed that 13.66% of the women that participated in our study currently had moderate to severe depression, and 12.8% of the women had moderate to severe anxiety. The data from our patient-centered portion of the screening tool showed that the most common major influence of mood was poor sleep. Most women thought mind-body relaxation would be most helpful to their mood, stress, and emotional health. And the second most common request that women wanted from their prenatal care clinicians was help with sleep. The data collected from the usability portion of our questionnaire showed that the majority of patients found the iPad screening tool was easy to use, and they were overall satisfied. I conducted some interviews with the 2 OBGYNs that used the screening tool as well. Overall, they were very enthusiastic and satisfied with the screening tool. They mentioned that the fluidity of the tool and the anonymity that it provided their patients as important factors for its effectiveness. These are some quotes from the interviews that we did with the physicians. In conclusion, we found that the tool was practical to administer and that it detected the expected rates of depression. The tool also found that sleep and relaxation were perceived to be major influences of mood by the patients. Some major problems we face going forward are the large population of underserved people, as well as inadequate mental health care resources in our community. I hope that this electronic screening tool and others like it can help bridge the gap we currently have in our healthcare system and get women the proper treatment that they need for themselves and their family to help ameliorate the morbid consequences of anxiety and depression around pregnancy. Thank you.
Okay, thank you, Alex. So we're going to hold questions to the very end. So please take note, and then After all five speakers, we'll go ahead with questions.